Good evening and welcome to this lecture organized by Studium Generale from Maastricht University. My name is Barbara Strating and I work as a program maker, and tonight it's my honor to welcome you to a lecture by Professor Bela Kubat. Tonight we're going to talk about forensic pathology. Her lecture is called Exploring the Fields of Forensic Pathology. And I'm really pleased that Bela Kubat is here to talk with us about this topic, because she isn't just someone. I think she is one of the prime figures within her field. I understood there are only six further forensic pathologists within the Netherlands, and she is the only one who actually has a full professorship on this field at Maastricht University. She has a long career in forensic pathology and worked on numerous cases, such as the MH17, also the Tsunami of 2004, and some famous murder cases. But tonight we're just going to talk about the work itself. But now, please give her a warm applause, Bela Kubat.
Thank you very much for the lovely introduction. Welcome everybody. I will take you on a hopefully interesting journey through the field of my expertise, which is the forensic pathology. But before we start on that, I would like to go a little bit back in history. Maybe you know who this guy was. It was Julius Caesar. And in the picture on the left side, you can see what happened to him. He was stabbed to death. That was on March 15, 44 BC. And actually, it's very interesting because that's one of the first written testimonies on forensic medical examination, because the body of Julius Caesar was examined by a physician, Antistius, and he concluded that of the 23 stab wounds, only one was lethal because it led to extreme blood loss and exsanguination. Now, this finding was announced publicly in an open space at the Forum Romanum, which then was called Forensis, and that is probably where the word forensic comes from. Around 1650, the term forensic came to use, meaning admissible in courts. Pathology is a medical discipline. We have many clinical pathologists, and as such, pathology is the study of the structural and functional changes produced by diseases. And forensic pathology is a subspecialization of pathology itself, one that looks into the application of pathology methods in the investigation of crime or sudden, suspicious, or unexplained death. And as such, it has become one of the many forensic sciences. When we look at the more recent history in the Netherlands, prior to the Second World War, forensic post-mortems were performed by physicians who wanted to do it, who agreed to do it, and were appointed ad hoc. And actually, universities and medical faculties were not really interested in supporting the forensic pathology. After the Second World War, in 1945, the gerechtelijk laboratorium, or the judicial laboratory, came into being by a governmental decree. And this laboratory was investigating physical evidence, for example, fingerprints. Few years after that, also the judicial medical laboratory came into existence, again by a decree of the government and because the universities were still not interested in harboring a forensic medical institute, it was placed under the Ministry of Justice, where in fact forensic pathology still resides. The two laboratories were housed in an old school seminar, as you can see in the picture on the left side. In 1999, the two laboratories fused and became the Netherlands Forensic Institute, or short, the NFI. And it was until 2015 that one of the universities, namely the University of Maastricht, really became interested in a forensic specialization and created the first chair of forensic pathology. It's the first in the Netherlands and the only as well. So what do we have in the Netherlands? We have approximately 350 clinical pathologists, and they perform about 2 million tissue examinations per year, mostly of living persons. So if you have a biopsy taken, it goes to the clinical pathologist and he will look whether it's a tumor or whether it's inflammation, whatever. Nowadays, the time is changing fast. We have 3 forensic pathologists in the NFI and 1 forensic pathologist in Maastricht, which is me, obviously. There are 250 to 300 post-mortem examinations per year. These are performed in the NFI, which is located in The Hague. And about 80 to 90 forensic brain examinations, which are performed here in Maastricht by my colleague, clinical neuropathologist, and myself. Now, if we look at the situation in the surrounding countries, you can become a forensic pathologist in 2 ways. Always you have to be a doctor, so you have to have studied medicine. Then in the Netherlands, in Norway and in Great Britain, you have to train as a clinical pathologist, and after the specialization in the clinical pathologist, you subspecialize in the forensic field. The other way to do it, which is, for example, done in Belgium, in Switzerland, in Germany, and other German-speaking countries, is you study medicine and then you train directly in the field of the forensic medical expertise. So, as I said, in the Netherlands, we have only 1 department of forensic pathology within the Netherlands Forensic Institute in The Hague. But we have a cooperation with Maastricht University, the Department of Pathology, where the brain examinations are performed. In other countries, the forensic pathology institutes are actually university bound, and there are more than 1 per country. So if we look at the medical forensic department of the Netherlands Forensic Institute, it is not just pathology, obviously. There is forensic anthropology. Those are experts who perform skeletal examinations. There are forensic physicians who perform, in some cases, in the more complex cases, examination of living persons. There are the forensic pathologists who perform post-mortems, and there is a very close cooperation with forensic toxicologists because intoxication can explain the death of a person. And since the recent decennia, we also cooperate with the forensic radiologists who perform radiologic examination of the deceased. So what will come to a forensic post-mortem? If we want to answer that, we first have to look at the difference between natural and unnatural death. Natural death is death due to disease or a correctly performed medical treatment. So if a surgeon performs an operation and it comes to a complication and the patient dies, then it still is a natural death. Any other causes of death in the Netherlands are unnatural deaths, which means killing, any kind of accident, euthanasia, and also those deaths where we actually don't know why the person died. And I put two diagrams in the slide where you can see the development of post-mortems in the clinics, and you can see that over the years there is a decline of the number of clinical post-mortems, which means that potentially the number of causes of death which we don't know and will not find will increase. Besides, we know from clinical studies that approximately 45 to 50% of the causes of deaths defined by clinicians are incorrect. And that is very important because we can find the cause of death in many, many cases by performing a clinical post-mortem. But if we don't do it, the wrong causes of death will be added to the statistics. And the national statistics are also used for political decisions. Where do we invest money in medical care? And if the statistics are not good, then these decisions may be wrong as well. That is the importance of clinical post-mortem. The other diagram also shows the decline of post-mortems in the forensic field. And that means that potentially we may miss crimes. If we look at the general data from the population, per year approximately 150,000 persons die, and about 6,000 of them are declared unnatural deaths. And most of these deaths are accidents, traffic accidents, personal accidents, industrial accidents. About 1/3 is suicidal deaths, and about 10% is unknown cause of death, which is quite a number of persons. And as you can see, only about 3% is violent deaths, that is those we discover. If we look at the causes of death in the NFI population, which is those that come to forensic post-mortem, approximately 1/3 is shooting and stabbing. About 16% are intoxications, but that doesn't mean that we have terrible murderers running around poisoning people. Most of these intoxications are accidental intoxications of people who use drugs and then it goes wrong and it has quite a wrong effect from what they aimed it to be. About 12% is blunt force trauma, which means hitting, kicking. About 8% is suffocation, and usually that is strangulation. The 3% of other causes are very unusual causes like small airplane crashes or diving accidents. And a large group of about 1/3 is a group where during forensic post-mortem we either find no cause of death or we find a natural cause of death. And both can be important for the relatives because it is important to know that the person you loved wasn't killed, and it is important to know what natural cause of death there has been, because maybe it can lead to treatment of the relatives to prevent other fatal accidents in the family. A forensic post-mortem has several steps. In about 1/3 of the forensic post-mortems, prior to the post-mortem, a radiological examination is performed. Then we have a short intake where the pathologist gets some information on the case. The information must be relevant. So, for example, if a person has been missing for 3 weeks, the police will tell us because we need to state whether or not this person has been dead for 3 weeks. Then we have the external and the internal examination, and immediately after the post-mortem, the pathologist will give the police and the investigators a preliminary report with the findings so far. Then ancillary examinations are performed, and after that, when everything is finished and all results are there, there will be a final report on the case. Let's look in more detail on the different steps. The forensic radiology, the post-mortem radiology, is mostly performed by post-mortem CT scan of the whole body. Sometimes we also use MRI scans, but that is not the rule. And in special questions, we will need old-fashioned radiographs, but usually it's the CT scan. And it allows us the examination of less well-accessible areas of the body, like the face or the pelvis, the arms and the legs for fractures, because it's usually the bone structures that are very well pictured in the CT scan. We can use it for reconstruction. We can use it for identification of areas of interest or special objects. And of course, as it remains stored in the computer, we can use it for the documentation of injuries. So on the right side of the slide, you can see a picture of such a CT scan with several very bright white objects. Those are projectiles in a shooting accident, and if we know where they are, it's easier also for the pathologist to find them in the body. Looking at the less well accessible areas, the two slides or the two pictures will show you why it is important. In the case of the skull, we don't cut in the face, but here we can very nicely document in a 3D reconstruction of the CT scan what damage has occurred to the facial bones. And the same is true for the pelvis, because you can see fractures in various places. And the pelvis is a place where we can't come because there are so many muscles around it. And the CT opens us the possibility to document these lesions. The reconstruction and documentation can tell us something, for example, about how a fracture occurred, from which direction the forces worked on the bone to cause this fracture. It also allows us to reconstruct shotgun trajectories, as you can see in the middle slide. Firstly, you can see a line. This is how the bullet traveled through the skull. And if you look in this place, you see very bright little particles of bone, which tells us that in this place the bullet entered and then traveled and exited on the opposite case. And in the left picture, you can see that we can use it in some cases for examination of objects which caused the injury, because here you can see very nicely that it must have been a small oval or rectangular object which caused the injury to the skull. We can do more with radiology sometimes. If we have to go to the field, we can use a small X-ray apparatus called the Nomad, and we can do some examination with that little guy. We can use a dual energy CT scan with 2 different sources of X-ray, and this allows the recognition of different materials. For example, in this slide you will see heroin red and cocaine is green, and these are little pellets which the person has swallowed, and they are in the intestine of the person. So doing this dual energy X-ray, we know what material is inside, but we can also use it for analysis of different metals if it's important. And sometimes we cooperate with the customs. As you can see here, this is a custom X-ray car. That was in a case where we suspected that there is a body in a container, but we weren't sure, and we didn't know in which position the body was in it, if it was in it. So we asked the customs to come with the car and to make an X-ray of the container, and where the arrows point, you can see a foot. So yes, there was a body in the container, and we knew in which position, so we could open the container more confidently, knowing that we will not damage the body. The external and internal examination focuses on injuries, obviously, external injuries, also internal injuries to the inner organs, and of course signs of disease, because even in forensic cases, disease may play an important role. For example, if for example, elderly person is attacked and he has a diseased heart, and during the attack a myocardial infarction occurs, we have to find it, because that will explain the death, but it will also play an important role in for the judges to make a verdict on this case. We also look at post-mortem changes, because they can be important for the timing of the death, for the investigation of the so-called post-mortal interval, the interval between death and examination of the body. And these post-mortem changes are first a decrease of the body temperature, the body cools down. Then you get the rigor, which is stiffening of the muscles due to lack of energy in the tissue. You get the lividity, or livores mortis, which is blood that sort of under the influence of gravity descends to the lowest parts of the body, and eventually there is decay, which knows 2 phases. One is autolysis, that is the first phase. It's a period where enzymes from the tissues come free and start to digest the tissues, and later on bacteria grow in the body, and then we have the phase of putrefaction. And in the diagram, which I borrowed from food industry, this is a diagram that is used for fish. You can see that there is autolysis first in 2 phases, and then the bacterial activity and putrefaction occurs. And of course, during the external and internal examination, we also collect tissues and fluids for further examinations. Well, what do we do as further examinations? One is microscopy, which is microscopic examination of tissue. We search for disease. For example, in the upper photo, you can see these pinkish cells of the heart, and this is infarction, whereas the less intensive pinkish cells are still alive and normal. But we also search for trauma. The middle slide shows a microscopic photograph of brain tissue, where with a special technique we can search for trauma to the brain, which can be quite delicate. You can see the brownish discolorations of the tissue, and those are traumatically damaged parts of brain cells. And in the lower part, you see the hemorrhage caused by trauma, also in the head, and based on the evolution of the tissue, the picture we find, which changes from fresh blood into scar tissue, we can also estimate when the bleeding occurred. So that can contribute to the case as well. We collect samples for toxicology, and we can perform some biochemical tests as well. For example, if a person who is known with diabetes is locked in a cupboard for a period of time and comes to die in the cupboard, then we can look whether the cause of death is dysregulation of the sugar due to the diabetes, and that again can be of importance for the judges and for the case. We can perform microbiology in search of infections, which then of course contributes to a natural cause of death, and we can collect material for anthropology, microtrace identification, and gunshot residue examination. I will come to that in a moment, but first I want to focus on 2 other terms which you might have heard in the media, on television. One is forensic science. Forensic science is the application of scientific methods in a legal investigation, such as post-mortem, because we take it from clinical pathology and apply it in a forensic field. But this goes also for fingerprints analysis, toxicology, or digital data retrieval. And criminalistics is the analysis and interpretation of physical evidence by means of selection of relevant data and correct interpretation. And correct interpretation is, if possible, evidence-based, so based on literature and analyzed by application of correct statistical methods and interpretation. And this combination of data can lead to what is quite new in these examinations, and that is the reconstruction of activity. And reconstruction of activity is, in fact, reconstructing to what people did, how they moved, where they were standing, what they were doing during an incident. As you can see in this diagram, then you have a lot of traces. You apply forensic science. From the forensic science, you get the data, and then you use criminalistic interpretation of all the data together. The combination, it must be logical, it must be objective, and it must preferably lead to the level of activity. Maybe some of you, maybe many of you, watch CSI. I watch CSI as well, together with my children, but I never am allowed to comment on the films because it spoils it for my boys. And that's the reason why I would like to talk a little about fiction and reality. And I would like to speak about the time of death estimation. I would like to show you a little bit of real CSI in anthropology and microtrace identification, as well as say something about the special light sources, which you see in the films, usually blue, and something about gunshot residue examination, which also is, in my opinion, quite fantastic. So in the films, the forensic pathologist looks at the body, does a little bit of examination, and then he is or she is able to state, well, the person died yesterday at 10 o'clock and 30 minutes. That's fiction. We can't do it that well, unfortunately. In the first phase, so firstly, the estimation of the time of death is based on the evolution of post-mortem changes. And in the past, the stiffening, the rigor, and the lividity, the livores, were used. But the best measurements we can use up to today is the cooling of the body. So you measure the body temperature, and by that there is a model where we can estimate the time of death. You can imagine that the cooling of a body depends on the surroundings and on the body itself. Thin people cool faster than obese people. People who have warm clothes will not cool that quickly. That's why we get dressed warm in the winter. If somebody is laying outside in the wind in the winter on a cold floor, this body will cool much faster than a person who is covered with a duvet. So all these variations are not in the model. That's why our real time of death estimation is only an approximation, and the longer it is, the less exact it becomes. So when we come to the phase of decay and putrefaction, we can only guess in terms like several days or maybe a week or more weeks. In that period, if they occur, we can use the identification of insects, which is performed by specialists in the field of biology, because the eggs and the maggots and the flies are collected, and these specialists know for each type of fly how long the cycle takes to develop from egg to fly. So with the help of this collection, they can estimate the time of death in bodies who have been dead for a long period. But even that has its limitations because, for example, we know that if there is cocaine in the body, so if the person took cocaine, these flies and maggots will develop much faster, and we have to take that into account. We have some newer ideas. One of them is the chemical analysis of the eye fluid, the vitreous humor, and that has been investigated recently, but is yet not so well evidence-based. So we come to anthropology and microtraces. Anthropologists are specialized in the examination of skeletons or bones, and what they can do in unidentified persons is age estimation, sex estimation, and body length calculation. For example, the age estimation, that is quite a new method, can be done by microscopic examination of a tooth. As you can see in the left upper slide, you see a photograph of a tooth, and the outer black line is enlarged in the lower part of the photo. And if you look carefully, you will see there are rings in this outer part. And these rings are exactly the same as the rings of the tree trunk. So if you count the rings and you add the age when people get their permanent teeth, which in Netherlands is, I believe, for this sort of tooth at somewhere between 9 and 12 years, then you have the age estimation of the person. The anthropologist also looks at injuries such as cut injuries, stab injuries, or defects in bones, as is shown in the left photo. There is a rounded defect in this bone. It's not complete, but we can imagine that it was caused by a rounded object. And there comes the CSI, because when we take this defect and we examine it with electron microscopy, which enlarges it very, very much, we can see very, very tiny traces of metal in it, in the bone, and the electron microscope can analyze what metal types are in these microparticles. So in this case, it was chrome and iron and nickel. And if you then find an object which might have caused this injury, then you can match it with the microtrace analysis. In this case, it was this technical object. I don't know what it is, but you can see it's also damaged, and this part caused the injury. The special light sources is usually blue light, sometimes also green light, which only has one phase. Our daily light has a scala on wavelengths, and we can see them nicely if you look at the rainbow, because then they are pulled into different beautiful colors. The special light sources only have one color, and sometimes it's possible to visualize injuries better with these special light sources, as you can see in the upper left photo. So the lower photo shows the injury in normal light, and the upper left photo shows very nicely the circumference of that injury, and that was caused by this hammer. What is wrong in the films? They use the light in daylight. You can't do that. You always have to use it in the dark. But then, of course, you couldn't see the film, so that's why they always film it with some kind of daylight. And lastly, I come to the gunshot residue. If you fire a gun or a pistol, there comes a cloud of burnt gunpowder. And this cloud of gunpowder travels together with the projectile. And as it travels, the diameter enlarges. And we can use that in different analysis. Firstly, we can see by visualizing the gunshot residue which injury was the entrance and which injury was the exit wound, for example, on clothes or even on skin. We can also visualize these particles, for example, on clothes or on the skin. And because the cloud enlarges, the further you are as a shooter from the victim, the less particles will impact per centimeter. So if we measure the condensation of the particles, we can estimate the distance of the shooter from the victim up to a distance of approximately 1 meter. Beyond 1 meter, there is no gunshot residue. But that distance can be analyzed and we can say how far the shooter was from the victim. And in some cases, if the analyst is lucky and two different sorts of ammunition were used, it is sometimes even possible to say the sequence of shots. As you see in the bottom diagram, the particles have different parts in it, different materials in it, lead, all kind of elements. And sometimes different ammunition has a different concentration of these elements. So if you have a shooting in a room, for example, there is a first shot which forms a gunshot residue, for example, on the wall. And then there is a second shot which forms a layer on top of the first shot. And if the residues differ, then the analyst can say which shot was first and which shot was second. And I think that is quite CSI as well. And so I come to the end of my talk. Thank you for your attention.
Thank you very much for your talk. For anyone who is watching from home, please note the questions in the Q&A. There's one already. I will... sorry. But first, so please ask all your questions. But first I have a question which is kind of a layman question, but that's obviously what I am. We are not co-workers as such. In the CSI series, so the forensic pathologist is always in a basement, a kind of green, shady room, which is really cold. And I was just wondering, what does your workspace look like if you have all these different kinds of techniques?
Well, these techniques are performed by different departments. The post-mortem room is never dark, because you can't perform a good examination if you don't have enough light. That's the first myth in the films. Secondly, it's clean, it's sterile, because we have to work sterile, because we also collect DNA samples. So we can't have contamination. And that is a general rule, and I get always very angry when I see it in the films, we never, ever eat in the post-mortem room. Of course not. You don't eat in, when you perform operations, and you don't eat in the post-mortem rooms, and they always do it in the films, which makes me very angry. But it's very light, and we have furniture there, of course, cupboards and tables, which can be well cleaned and sterilized, which is done regularly.
But you have an office apart from the abduction room?
Yes, 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 we do.
Okay. There are quite a lot of questions in the Q&A. I'm just going to scroll around them. Also, there are a lot of compliments. People really, really enjoyed your lecture.
Thank you.
Oh, there are lots of questions about television. Oh, there is actually a question that's quite similar to a question I had as well. So you are a professor in forensic pathology, but you're also specialized in forensic neuropathology.
Yes.
And someone is wondering what it is you do within your brain center here in Maastricht. Could you maybe elaborate a bit?
Yes, yes. Well, we perform the brain examinations for the NFI in search of and proof of traumatic brain damage. So very often when people are hit or a child is shaken or injured, we look at the brain, we do the special stains, and we look for microscopic proof of brain damage. Yeah. Because you can have a hematoma on your face, but still you don't need to have brain damage. So it's important for the investigation of the case and judgment on a case to see whether there was or was not brain damage, because it tells something about the severity of the injury.
Okay. But these abductions on brains, are they also with like the smaller samples, or is it like the actual,
no,
like
to
the
be
horror
able
movie?
to do a post-mortem examination of the brain has to be prepared chemically.
Okay.
That's called fixation.
Yeah.
It has to fix for a number of weeks, 6 weeks, before we can examine it. So it's kept. Yeah. It's put in formalin, that is the way to fix it. And after 6 weeks, we can do a cut-up and take the samples of interest from the brain and perform the microscopic examination. Okay. And the relatives can, if the district attorney gives permission, receive the tissue we did not use for the forensic examination. They can ask for it, they can receive it, and they can bury it. So, but we really need to first to get the whole brain, because it has to be fixed. Okay. If we don't fix it, we introduced artifacts which we cannot distinguish from real injuries, so our examination would not be good.
Okay, thank you very much. I'll come back to the Q&A in a couple of seconds. For now, please also upvote the questions you find most relevant, because there are already 15 and I find it really hard to read them all. But I was wondering, Bela, because it seems that there is a lot of new techniques when it comes to your fields of expertise, that this has developed over the years quite a lot. I think, especially in opposition, when you started maybe 20 years ago. There are a lot of new techniques, also the electron microscope. But are there any techniques that you are looking forward to, that you would like to find out about?
Yes, of course. For example, for the time of death estimation, we now know from DNA examinations and new findings that there are genes which are switched on after death. That's fascinating.
It's really fascinating.
And so maybe if we have the possibility to examine that, switching on and off these genes could give us a good method for the time of death estimation. That would be very interesting, for example.
Is that something that is under investigation already, or is just something that you can dream of?
It's quite new, because these genes, they are sleeping genes, and we also know that some of them switch on during severe illness. They are called, I forgot, zombie genes.
Wow.
Zombie genes. And some of the zombie genes are switched on after death, and that is quite new. So we still would have to look at the possibility to examine that.
Yeah. There are a lot of questions that have to do with your job after the examination, but before we go there, I will go there in a couple of seconds. I have just one other question that came up into my mind when I was listening to you. That the Judicial Laboratory was founded in the Netherlands in 1945, which is quite of a landmark year, I would say. Is there a relationship between the Second World War and the founding of the
Well, during the Second World War, everything was different, so there was no possibility. And after the Second World War, with reintroduction of government, creation of ministries, and introduction of democracy, probably the founding fathers thought we need something to examine forensic cases. That's all I know about it.
Okay.
It has no direct...
it wasn't founded to, for instance, examine the genocide that was...
no, not to my knowledge.
Okay, well, thank you. Obviously, you have a career that is also a lot in the media and that people have thoughts about. And one of the questions is, could you tell us about a case that has fascinated you the most in your career?
Well, every case is interesting because every case poses questions which I have to answer up to my best ability. But I was involved in some very interesting incidents. One of it was the identification of victims after the tsunami. I learned a lot about identification, also in other fields, and we did, I think, quite a good job there, not just me. There were many people who were involved.
I read today 230,000 victims.
Yes.
Casualties.
Well, I was on a site where there were 4,000 victims.
Yeah.
And I was there for 3 weeks. So, okay. After me, other people came and...
But you were there as part of the Dutch...
identification team.
Yeah. Okay.
Yes. And the other one was our participation in the MH17 disaster, where the NFI participated in the forensic examination of the bodies. So not the identification, but the forensic part, the medico-legal examination of the bodies. And that was also, very impressive.
I can imagine. Because it was also, I mean, that was a trauma for the Netherlands and also I would say some other countries in the world as well. and to work at that theme with as in the center, that must be really hard.
Yes, it is quite hard because all you see during the day is death around you. On the other hand, it's very important. And I have always been proud to be able to contribute to clarification of crime.
In that case, there's another question that kind of relates to this topic. It's a forensic pathologist. Do you ever come across, do you ever come in contact with the public or members of the family?
No, not in the Netherlands. For example, in Britain, it's quite common that the forensic pathologist, also talks to the family. In the Netherlands, we don't see the family.
Okay.
It has some advantages because you don't feel the emotion and the grief, which can cloud your analysis of the problem. On the other hand, I think it's a pity because I can imagine that the family would like to talk to the person who performs this very, very personal examination, and we would be able to explain what we do and why we do it. So that's why if I get the opportunity to tell the public what is done and how it's done, I am very thankful for that, because I think they are entitled to know. And maybe it would be good if the pathologist also talked to the family.
But that's never the case in the Netherlands.
No, it's never the case.
Also when it comes to these traumas like MH17.
It's never the case,
It's really, I didn't realize that because, as you said, it's a personal examination.
Yes.
So you know the body of the deceased that well.
Yes.
Like you know them as well as someone who loved.
You touch the body. So that's very, very personal.
Yeah. Is it also what you like about your job?
No, okay. It's not that I dislike it. It's part of what I have to do to come to a result. What I like is the puzzle and the possibility to contribute to the case and also to give the relatives answers.
Yeah. There's another question that's somewhat related to what you just said. How do you deal with the possible bias in your work? For instance, the way details of a crime can influence your interpretation of evidence.
Yes, well, it's always there. Nobody can say he has no bias. It starts when a body is brought to a forensic post-mortem. That's the first bias, because you think there was a crime, potentially. So the only thing you can do is be aware of your bias. Ask yourself always, is it really what I saw? Is it the right interpretation? Could I interpret it in a different way? And secondly, there are systems, so we discuss the cases with the colleagues, and the reports we write are read and checked by a colleague who is not involved in the case, and by that we hope to minimize the risk of a bias.
Yeah, thank you. You, as a pathologist, you write these reports and they go to the
prosecutor.
Thank you very much, because I am Dutch and I'm not really familiar with all these terms in English. And then there is this lawsuit, probably. Do you have a position within that system as well, or is it just a report that's there?
In most cases, the courts use our written reports, because in the Netherlands, it's not obligatory that the expert has to come to court. For example, in Germany, every medical legal expert has to come to court and give answer to the judges. That's not the case in the Netherlands. But in some cases, when one of the parties or more parties, so the judges or the prosecutor or the attorney of the accused person have questions and want them to be answered, we have to go to court and give testimony.
And that's always on your own report. It's not that you are involved as like a second pair of eyes.
Usually mostly it's our own report. It can happen that, or we could be asked to give a second opinion, as it's called, on other person's report.
Okay.
We do have second opinions on our reports, which are produced usually by foreign experts, people who work in the field in Belgium or in England. So they do the second expertise or second opinion on our report.
Yeah. There's another question I find really interesting. Do you remember your first case as a pathologist, and how did you cope with it?
I don't remember the very first case. I do remember my first case of a small child.
Okay.
Because children don't make very many bruises on the outside. And this child had very, very severe internal injuries. I didn't expect it from the external examination because you didn't see anything on the body. And then you look internally and there were lethal and very severe injuries, especially in the abdomen. So that I remember. And also it's a child. Children are special.
Yeah, do you remember all children that you have?
No.
No.
Okay. It's just this one.
Because I can imagine this is a kind of work that that you try to leave at home, but at the same time, sometimes I must imagine that it's really difficult.
Sometimes
step aside.
It's difficult, but usually you have to. We do have emotions, otherwise we wouldn't be human. So fortunately, we do have them. But while I am working on a case, I have to disconnect from the emotions.
Yeah.
And one important thing for me is to be able to come home and have a warm home, understanding home, at home, my partner, my children. Not that I discuss the cases because I'm not allowed to, but in general, you can say I had a terrible case today with a lot of injuries. And it's good just to mention that and get a hug and a warm meal and a glass of wine or something like that.
Yeah, that's something that we all need from time to time. Yeah, but I'm really happy that it's there. There are also a lot of questions again about CSI, and I'm just going to paraphrase them because I cannot ask them all. I'm sorry. Is there a show, series, or a movie that you've seen that would pass your critical eye for being reasonably realistic?
Some parts of Silent Witness.
Yeah.
And I used to watch, I don't think it's shown now, but in the past, few years ago, I used to watch Dr. G. I don't know which television program it was, and Dr. G was very good.
Okay.
That was realistic.
So that's something that we all have to Google and go and see.
Yeah, maybe you can find it somewhere.
Maybe it's on Netflix even. Bela, I have another question because I've researched your work a bit, and in one of the interviews I read, you said that you took on the position here at Maastricht University because you would like to train doctors a bit more about your own field of expertise. Yes. Maybe you can tell us why.
Well, it is not a regular part of the medical curricula. And we know that what you don't know, you don't see.
Yeah.
So training them in forensic medical problems, showing them injuries, showing them interpretation of injuries, making them aware that injuries occur because they saw them, will make them hopefully recognize them even in living people and prevent worse, recognize maltreatment, inflicted injuries, and that will contribute to prevention. So I won't have so much post-mortems to do in the end.
Because they maybe can find out before the murder is there.
Before the person dies of the injuries, yes, because many people are maltreated before they come to die. So that's important to see and to take measures.
Is it part of the curriculum yet?
No, not a standard one, but we do have, together with the forensic radiologist at the university, because part of the forensic radiology is also performed here in Maastricht, in the hospital, and together with a forensic physician, professor at the law university, we do have courses where students can inscribe and take part. And they are always filled up.
Always?
Always.
And did you already meet some doctors that told you, I have met someone who is in my my room and I think I've learned from you the science?
Not yet. Not yet. Apart from that, actually, if it's a treating physician, he's not allowed to tell me.
Okay. Oh, that's
it's
also
medical
really hard.
secret, yes.
So they have to go to another...
yes, they have to take the regular steps, other steps.
Just some other small questions. Thank you for the lecture. Though I'm not trained as a doctor, I am very interested in crime scene investigation and forensic science. Can you recommend any areas in forensic science which are not as medical as pathology?
Oh, there are very many. There are special statistical analyses that can be used for different purposes. One of them is the base statistics, which tells the probability by which some trace would be found somewhere. Other fields are digital techniques, retrieval of digital data, which is very interesting, and NFI is very good at it. They have some they have developed some methods, and so NFI, for example, is capable of reading out an iPhone, which is quite a problem sometimes. And if I can do it. I was told, you know, I can't, I'm a doctor. So yes, and there is explosives, there is ballistics, there is pollutional crimes, which can be quite interesting. So yeah, there are many fields.
So it's not just one person working on a case, there are multiple...
There are many persons working on it, and that's why combining all the data in a logical way is very important, because you gain information by a logical combination of all the findings you have from all the disciplines.
And who is in charge then? Are you in charge, or is there some other project leader?
There is a project leader, yes.
Yeah. And also
the NFI has a chief scientist who also overlooks the process. He is not involved in the case, but he looks whether everything goes unbiased and with the correct methods, etc. So that's thrilling.
Really thrilling. It's really fascinating to learn about this.
Yes.
Yeah. Another question. Thank you for the interesting lecture. Does it happen nowadays that the advanced radiological examination already gives enough evidence and that the internal examination is not needed anymore? If not today, is this to be foreseen in the future?
Well, the CT scan cannot visualize very well or at all structural changes or injuries to organs. So if you want to see where the bleeding came from, for example, if you find a lot of fluid in the abdomen, it can be water or body fluid, it can also be blood. Sometimes you can't distinguish it on radiology, so you have to test, but then you could aspire a little bit of it and see what it looks like. But an abdominal bleeding can come from a diseased vessel which ruptured. It can also come from hits and kicks in the abdomen, so which ruptures a healthy vessel. So you have to look at the vessel and then you have to do the post-mortem. Using MRI will show probably more of soft tissue, organs, for example. But there we have one problem. MRI uses magnetism and movement of molecules. And if you cool something, as a fluid, for example, it freezes. So the molecules move less. If you cool a body, all the molecules in the body move less than with the normal body temperature of living persons. So that is one technical problem which has to be overcome with MRI, and they are doing it. The technical guys are really brilliant, so that will be solved. And potentially the resolution of this MRI might be increased, that is theory, might be increased to a molecular or cellular level, and then maybe you wouldn't need the post-mortem. But to this day, if you really want to have maximum yield of your examination, we have shown in clinical cases that the combination of post-mortem scanning with a CT and a post-mortem by the pathologist gives the best results. So it's again a combination of techniques.
Another question. Can you as a forensic pathologist recognize and determine potentially staged death? For instance, trying to make an unnatural death look like a natural death, or create confusion about the activity that really occurred?
Sometimes we can, or at least we think we can. In those cases we can't, we don't know it. But as an example, and then again, it's not the pathologist alone who does that. But as an example, there was a case of a person who was found in a burnt house. So the body was extremely damaged by the fire. It was charred by the fire, and we did further post-mortem examination, and we found that this person was strangulated. We found lesions in the muscles of the neck, and the toxicologist looked at coal monoxide concentration in the blood, because every fire produces coal monoxide, and there was none. So by that, we knew this person didn't die because there was a fire in the house, but this person was dead before the fire started. And I don't know why the fire started, but then of course the police come to the conclusion we have to look who started the fire. So sometimes we can do it, yes.
Okay. And that's something also maybe that the technique will progress over the years and even make it more
available.
Available.
Yes.
Okay. Bela, I would like to wrap up this evening, but I have one final question. Because I can imagine that in your profession you come across a lot of sad stories maybe, but also other things. And when it comes to your profession, did it learn anything about the meaning of life?
Oh yes, definitely. Being a pathologist, you see things from the perspective of the post-mortem table, my father used to say. And seeing so much suffering, not only in forensic pathology, but also in clinical pathology, because sick people suffer before, sometimes, mostly, before they die. Seeing so much suffering, you can enjoy a lot of life events, I think much more, even the tiny little ones, which some people, or maybe before I became pathologist, I wouldn't notice.
Yeah.
And for example, I can understand and accept much more limitations we are put up with in our life, for example, now with the corona, because it's much better to stay at home if the experts think it's necessary, and stay alive and enjoy life in the post-corona ages or years, than to risk getting infected, getting very sick, dying, or cause somebody else suffer this fate. So yeah, I think that as a pathologist, we, and my colleagues as well, look a bit differently at various aspects of life.
One lesson that you would like to share with us that we should really take care of right now? Because you obviously, you already mentioned COVID, and you did some abduction of bodies.
Be careful. Life is so precious. Nothing is as precious as life.
Well, thank you very much, Bela Kubat, for your excellent talk. I mean, I've learned so much, and also when I look at the comments, many of you agree. So thank you very much.
Thank you for being here.
Yeah,
I enjoyed it very much.
It was really lovely. And also everyone who is with us from home, thank you very much that you are still here, that we can still continuing offering you our programs via Zoom webinars. Hopefully next year we'll be here live. But for now, see you next time at another event. Thank you very much.